I think the future of healthcare is both the great care that we deliver here, but also I think there'll be many opportunities out in the communities in the South Shore. We really want to keep talented, hardworking, caring people in our hospitals and other healthcare facilities.
Hi, I'm Kate. I'm an EMT for Brewster Ambulance on the South Shore. After college, I didn't really know what to do. I had a degree, but nothing really seemed interesting enough for me to pursue. So that's when I came across EMT. I thought it would be a great position to just get my foot in the door and just test it out, see how well I do working with other patients and be in the position of a healthcare setting. A typical day's work looks like a lot of interfacility transports, or you're bringing someone to the hospital or to a doctor's appointment, and on occasion we do emergency calls.
So I've been in customer service since I was probably about the age of 15. Customer service and patient care is very similar, and so you kind of go, above and beyond for your customers just as much as you'd go above and beyond for your patients and their families. They really appreciate everything you do.
I became a CNA in 2011, and I've only worked in healthcare. I started in 2011 at a nursing home, and I worked on the rehab unit. I really liked it. I was fast-paced, I can multitask. The residents and patients loved me. I like being a team player.
A typical day in the X-ray department here is never typical. It's a very busy, high-paced, fast-moving department. I came right from X-ray school to Milton, so I've been here for 26 years. So.
Long time ago, about 40 years ago, I was at home. My dad had a medical emergency and scared the heck out of me, and I thought I want to go out and get some medical training, and got it into an EMT course and really enjoyed it and just took it from there. I sort of fell into it. I had really no interest or thoughts of getting into healthcare, but EMS, emergency medical service in particular, it's a great career. It's a difficult career, but it's very rewarding.
I'm Kim Driscoll, Health and Wellbeing Director. Welcome to the Y. I was working out on my own and I really started to enjoy it. And then someone suggested that I should do it for a living, which I thought was funny. Before I started with Health and Wellbeing, I was actually a cook. I went to culinary school and then decided to get on the other side of it. So I have been through the exercise science program and have my associates in exercise science and personal training.
We make sure that our teachers not only are paid for their professional development, but we encourage them to get their degrees. We have lots of different ways to help teachers pay for those degrees as well here at the South Shore YMCA.
I started in healthcare initially by becoming an EMT. When I was in my teens, I was witness to a couple of medical emergencies and I felt like I was lost and helpless. I didn't know what to do. So I started as a lifeguard, learned a little bit of first aid, liked what I was doing, decided to become an EMT in hopes of eventually becoming a physician. In that path, I learned that I loved what I was doing here in pre-hospital medicine. I decided to just stick with the field.
What initially led me to a career in health and wellness was my urge, my ability to help people, meet people where they're at. I really wanted to have that positive impact on people.
We always tell people, if you have the soft skills and the interpersonal skills, we can teach you the technical skills, whether that's in nursing, as CNA, radiology, or other technical areas. So we want hardworking, talented people.